In the UK, around 40,000 people depend on tube feeding to live independently at home. For these individuals, home enteral nutrition isn't just a medical necessity, it's a vital lifeline. That's why it's essential that services supporting this care are effective, responsive, and truly centred around patient needs. Experiences and views of support services for people living at home with an enteral tube. Enteral feeding is the process of feeding via a tube, inserted into the gastrointestinal tract, via the nose, mouth, or directly into the stomach or jejunum. There are many reasons why some may need to rely on enteral feeding. For example, people with cancer may have challenges with appetite, or people who have had an injury may find eating difficult. Some neurological disorders, such as motor neuron disease or the impact of having had a stroke, can make swallowing, eating and drinking very difficult. And so enteral feeding ensures the patient is able to stay nourished. Many people start enteral tube feeding in hospital, sometimes for just a short while, other times for longer. If feeding continues after discharge, it's essential they receive the right support at home. This means access to high-quality feed, contact with expert community dietitians and specialist nutrition nurses, and clear guidance on how to administer feed safely, comfortably, and with confidence. With this report, we set out to understand the current experiences of people transitioning to home enteral feeding and to explore what good looks like, drawing on real insights from patients and carers who share key challenges and provided recommendations for more holistic person-centered care. People who rely on enteral feeding and those who support them shared a range of challenges that make it difficult to manage tube feeding effectively. Many felt they didn't receive the support they needed, both in hospital and after returning home. Nearly half of survey participants said they felt unprepared to manage their tube before leaving hospital, highlighting the urgent need for clear, consistent, and reliable information. This uncertainty left many feeling anxious and unsure about how they would cope in the future. 1 in 5 respondents relied on support from family members or carers, while nearly half experienced issues with their tube falling out. So how can we improve care and ensure people feel more confident with managing their enteral tube feeding regimen and care at home? The report offers a range of recommendations to improve care. These include assessment and planning, training and education, coordination of care, monitoring and support, guidelines and standards, person-centered care. A key recommendation is to strengthen the training provided to individuals who rely on tube feeding after leaving hospital care. This includes supporting family members and peers in learning how to assist with enteral feeding. Training should begin in hospital and continue after discharge, with clear written guidance on living at home with an enteral tube and ongoing support to ease the transition. It's essential that patients receive contact from a healthcare professional within 24 hours of discharge. Multidisciplinary clinical teams must work collaboratively at every stage to ensure people's needs are met through coordinated, person-centered care. Individualized support is also critical. Creating a care plan for every person living with an enteral tube, providing trusted online and written resources, and making sure advice is consistent are key steps to overcoming these obstacles. Moreover, we recommend that care plans are built around and with the individual. Involving them or their advocate in discussions alongside multidisciplinary healthcare professionals will ensure that ongoing care is truly individual. Together, we can improve patient experiences and outcomes for people who are enterally tube-fed at home.